Welcome to Advocates for Change, a show that shines a spotlight on individuals and movements making a real impact, not just in our community, but also in the world. I am Caroline Shoenberger, your host for this empowering journey. The mission of the show is to inspire change, to share stories that resonate with the heart, stories of courage, resilience, and innovation. Advocates for Change is not just a TV show. It's a platform for voices that need to be heard, for ideas that need to be explored, and for actions that demand our attention. I am the Executive Director of the Shoenberger Public Interest Foundation. Our work is to assist our clients and other nonprofits achieve their missions. Prior to creating my foundation, I served as the Commissioner of Consumer Services for the City of Chicago, as a Cook County Assistant State's Attorney, as a faculty member of the Business Department at Harold Washington College, and as the Supervising Attorney of the Immigration Program at the Chicago Legal Clinic. Currently, I'm teaching a class in macroeconomics at Arupe College at Loyola University. I also volunteer for organizations such as the Chicago Volunteer Legal Services, a great organization. As we dive into today's episode, we encourage you to join the conversation, use the hashtag Advocates for Change on social media, share your thoughts, ideas, stories of change happening in your communities. Together, we can amplify these voices and make a difference. So I am really thrilled and honored to introduce Dr. Sandy Goldberg, the co-founder and Chief Executive Officer of a Silver Lining Foundation. Dr. Sandy also was the health and nutrition contributor for NBC in Chicago, now retired. Welcome.
Thank you so much for having me, Caroline. Well, it's fun to do this together, isn't it?
It is fun. It is fun, and I appreciate having you here. And let's talk about you and the Silver Lining Foundation. Can you tell us a little bit more about a Silver Lining Foundation and how it came to be?
My husband and I started a Silver Lining Foundation in 2002, as you know, Caroline, a result of my being diagnosed with breast cancer. Fortunately, being NBC5's health and nutrition contributor at that time, I had everything I needed, great support, great insurance, everything. And I ended up creating a little cable show, coincidentally, at Can TV. And I was the host, interviewing specialists in the field of cancer, all kinds of cancers, and people were calling in. And I learned a lesson, and I know you learned that lesson as well, Caroline. The fact that the people that were using our show were using it as their primary care physician. And I would call people, back in those days we used telephones, as opposed to all the stuff that I don't know how to use now very well. And I realized that people were, again, using our show as their primary care physician, but did not feel worthy to reach out for help because of financial circumstances or not having any insurance. That broke my heart. And from that, a Silver Lining Foundation was born.
So I understand this was around a kitchen table.
Yes.
This is what, a kitchen table, and how long ago was that?
I came home one night from a Can TV show, and my husband said to me, "How are you doing?" And I started to cry. Normally, I don't know about you all, but I generally cry when I'm watching television commercials or something happy or sad. And I started crying, and I was telling my husband about the show and about the calls. And he said to me, "So what do you want to do about it?" And from somewhere, I said, "You know what? Start a foundation." And that's how a Silver Lining was born. And we started at our kitchen table, as you referred to, Caroline, with one $2,500 check, which I thought was enormous. And now here we are, 18 years later. And the basis of our foundation, although there are multiple programs, is our program that we call Buy a Mom a Mammogram.
And it's a great program, and a lot of people can do this. And if you can tell us more and tell us the price, especially with Mother's Day coming up.
Right.
So you can, for Mother's Day, you can buy mom a mammogram.
You can buy somebody's mom a mammogram, that's for sure. We started off originally in our first program that's still in existence, just dealing with resource information and outreach, sort of like a holding house, for lack of a better way. And then one day I thought, we really should be funding testing. So we started thinking about funding mammograms, which for those of you that don't know is sort of the bottom of the food chain in terms of breast health testing. You start with a screening mammogram, that's the walk-in-the-door mammogram, and then if some anomalies, something is noted, you go up the food chain to different diagnostic tests. So we started off funding mammograms, and we decided we were going to name our program Buy a Mom a Mammogram. And then, our first year, we funded 95 women with mammograms. And then we started thinking about the fact, well, what happens if somebody needs more testing up the food chain? So we started adding more diagnostic testing. And we started with one hospital, and now, and this is beyond cool, Carolyn, we now fund 18 partner hospitals.
Oh my
18?
my goodness.
18 in the greater Chicagoland, Elgin, Rockford areas, but we turn no one away. And we have people coming to us from 15 states. We have people who come to us from other countries who are visiting their relatives. And we fund those tests, regardless of who you are, regardless of where you came from, regardless of how old or how young you are, for free. That's the word. 2 words, for free.
Can you tell us what hospitals and how did you arrange everything with the hospitals, and why would they be willing to work with you?
Well, I think that medical care in general these days gets a bad rap. I do. I do think that large medical systems, I mean, businesses are businesses, yet there are people involved in these medical institutions who care, who want to help the underserved, who want to help the undocumented, who want to help the underinsured and the uninsured. And I think that what we have done at a Silver Lining Foundation is basically to strike a responsive chord. And we go into hospitals that reach out to us. We do not reach out to hospitals. They reach out to us. And we go in and we talk to everybody. And, you know, obviously we want the equipment to be the way it's supposed to be. The training of the people is supposed to be the way it's supposed to be. You want to have navigators there if any issues come up. But what matters to me the most, would I send my own sister there? How would she be treated? And that's the issue more than anything else. You know, everybody's a human being. Everybody deserves dignity. Everybody deserves respect.
So, because Mother's Day is coming up,
Right.
and people can buy mom or someone's mom
Right.
a mammogram, how do they go about buying the mammogram, and how much does it cost?
Okay. First of all, any dollar that is donated to a Silver Lining Foundation, regardless of the amount, is used 100% for our breast health testing program. That's number one. Number two, all you need to do is to go on our website, A Silver Lining Foundation, spell it all out, don't forget the A. It's asilverliningfoundation.org. On the screen, you will see a little tab that says donate, and then you'll just press on donate, and it'll say, I want to help. And that's all you have to do. The negotiated cost of our mammograms, and I know this will shock some of you because we work, again, with 18 hospitals, and we negotiate all our rates for all our tests with our hospitals, again, who are doing a tremendous service by agreeing to take our cost. That's the cost of a screening mammogram is $135. But you know, Caroline, someone can't afford $135. Put 10 of your friends together. $10. Every single dollar that comes in our door during the course of the day is a dollar we didn't have when we walked in that door in the morning.
So $135
Yep.
buys someone a possibility of detecting cancer at an early stage.
Right.
Do you have an estimate of how many people annually receive the mammograms?
Every year, we fund tests for at a minimum 1,400 women to 1,900 women.
Right.
The numbers were a little bit lower last year, and they were a little bit lower because of the impact of the pandemic and the ability for hospitals to appropriately and carefully staff those departments.
I do understand that there's a great personnel shortage right now.
Right across the board.
And that is something that if people are looking to change jobs, you can get additional training. And again, healthcare is one of the ways to do it. But let us assume that someone goes and takes a screening mammogram and tragedy, they have cancer.
Yeah.
What happens then?
If they come through Silver Lining, they'll be taken care of for free.
Okay.
Nobody that walks in our door pays a dime. I mean, you of all people know that. No one pays a dime. You see, we talk about saving lives, and that you alluded to, and you're right. I mean, we do save lives, and our diagnosis rates are 5 times, 6 times the national average. But I think what's important to think about here, Caroline, is that we're not only saving lives, we're easing lives. I mean, you hear people scared to death, finally get in to get that test. And I've gotten phone calls. They're the best phone calls I get. I get a phone call and they'll say, call for you, Dr. Sandy. Yeah, and I go, hello. And a person will go, I'm such and such. I got a mammogram from the Silver Lining Foundation, and I'm okay. I'm okay. This is what we work for. And if someone is not okay, they'll be taken care of. That's the important thing. And that, when I talk about the heart, literally, of the medical community, certainly the institutions that we work with, there's never been one moment's worth of pushback.
So someone goes through, the vast majority of people are fine, they're relieved, they're grateful, but there are occasionally people with positive tests. Just to educate people, after a screening mammogram, what is the next step?
Well, that depends on the expert that are taking care of the individual. We don't pretend to write the orders. Our job, we are funders. That is what we do. We want people to get what it is they need, and we'll pay for it. I mean, it's a little bit more complex than that. Not really on the part of having people get testing, but the reporting from our hospital partners. How do we keep our statistics? How are we able to do what we need to do, particularly in terms of fundraising? But if somebody comes in and they have a screening mammogram and something might be seen an anomaly, just something doesn't look quite right. So going up the food chain, it could be the next step, could be, I stress that, could be a diagnostic mammogram, or it could be an ultrasound, or it could be an MRI, or it could be a biopsy. That's the way we look at it. But the most important thing, and for those of you that are watching this, is not to be afraid of the possibility of a diagnosis, because statistically it shouldn't happen. I mean, it's a relatively small number of people, yet our numbers are higher than the national average. But in early stage breast cancer, caught early stage, a person going to go on and live a long, normal, happy, healthy life. The point is, when did you catch it? When was it caught?
A lot of people, not only the cost of medical care, they're afraid that they'll get bad news.
Right.
And what you're saying is, the earlier you get the bad news, the better you are.
Well, the earlier you get the news, I think, there's this old saying, knowledge is power. And if you know, you can do something about it. And for those people who come to our hospital partners and are taken care of, and taken care of superbly, I must say, by the navigators in those hospitals, is that it's very clear what has to be done. It's very clear. And one can go on and, again, as I say, continue on with their life. When I was diagnosed, which is this coming Saturday, 24 years ago.
Oh, my goodness.
Yeah, on the 20th of April.
Wow.
Times were a bit different. Technology was different. Treatment modalities were different. And here I am, 24 years later, able to say that every time I go in for my annual test, which I do, and every time I walk in the door, I go, I've been good, I've been good, you know. But they always say to me, yeah, you must have been good, Dr. Sandy, because everything is fine.
Thank goodness.
Yeah, and that is what we look for, and that is what we want for those people we serve.
And a lot of the people that you serve, again, probably have never had a mammogram in their life. This is the first time, and they may have felt something or someone encouraged them to get one.
Well, we get referrals from multiple sources. You know, certainly federally qualified healthcare centers, our partner hospitals, word of mouth, community clinics, a lot of word of mouth. And some people have not had mammograms or breast health testing. Some have lost their insurance. That was a big, big subject for us, particularly during the height of the pandemic, that people would go to bed one night, they had a job, they had insurance, and they woke up the next morning, and they had neither. This is when we stepped in. Are there people that before this tremendously awful upheaval in the world who are living in, who are living in other parts of the world, who had jobs, who were able to access health care and had to flee their countries with their clothes on their backs, and that's all which you certainly know about. And now they're here and they don't know what to do. That's where we can help. That's where we can help. Because we don't ask anything. And interestingly enough, we don't take any government funding.
Government funding always has strings attached.
There you go.
And I think a silver lining foundation is the fact that there are no strings attached.
There are none. The philosophy of a silver lining is based on the philosophy of my late mother. She would always say, we're all family and we have to help each other through the tough times. And many of us have go through so many tough times for such an extended period of time. And we have people who are stunned that we even answer the phones. Well, this is unfortunately the world that we live in today. But that is not the world that we have to live in.
No, everything is sign up, everything is through the internet, and a lot of people, they may have phones, but they don't have internet. And you have people on your staff who are Spanish speaking too.
We have the most wonderful team.
You have a great team.
They're just remarkable. They're remarkable. And it matters, you know, and people know when they call or when we go out and talk to different groups, and people know if this matters to you or if it's an elevator speech. You know.
Well, so given the scenario that, you know, again, we're coming up on Mother's Day, and this is a perfect opportunity to do some good in the world. Let's assume that your mother has never had a mammogram, or your sister, your aunt, your grandmother. What is an approach that you can take besides, again, $135 starts the process,
Right.
which hopefully ends with that. But how do you convince someone to take that first step?
I don't think you can convince anybody to do anything, frankly, in all candor. I think you can say, or we can say, you know, because a lot of people know about mammograms. It's not that they don't, but they're hesitant for what you said, that what happens if there's something wrong. It's a good idea. You know, I heard about this organization. You can get your mammogram. It doesn't cost you anything, and they're really pretty nice people. But I wouldn't push. That's the whole thing. I wouldn't push. And I think who are very important messengers in all of this, Caroline, are our young people. Because young people many times, especially if you're talking about the immigrant communities, who is the voice of the family? Here, I'm preaching to the choir when I'm talking to you here. You know, but who is the voice of the family? It's the young people. So if the young people know and they talk to the older people, that's a different story altogether. It is. But I think also in some of the communities in which we work, people are afraid that somebody's going to come in the middle of the night and take them away and send them back to wherever. We don't work like that. And we have a remarkably, and I'm very proud to say, good reputation in terms of what we do in all of the communities.
Well, again, not taking government funding, you don't have to report to the government about the clients and their addresses or anything. I do understand, having been involved in immigration work for most of my career as a lawyer, I do understand that, but a lot of people don't. And again, one of the beauties of this wonderful organization and the work that you've done is the fact that you can say to someone, it's confidential with us. It's confidential with us, and the hospitals don't ask them.
You know, it's our hospitals understand their role, and their role is to take care of human beings, and human beings who are referred by a Silver Lining Foundation. That's why I'm so proud of what we do, and I'm so proud that we have a hospital group partnership.
Can you maybe give us a couple names of some of the hospitals, just so that people know?
Oh, I'd love to.
Okay.
I'd love to, I'll just, and please, those of you, do go on our website, asilverliningfoundation.org, for a complete list, or call us. I'm going to give out our phone number. Is that all right?
I was about to ask, but go ahead.
Yeah, I put Carolyn in the corner here.
That's
Can
okay.
I give the phone number? All right, please feel free to call us at 312-345-1322. We can take your information. You'll be sent a service voucher, either through the mail, I think both through the mail and electronically, if you have the electronics that are capable of doing that. But some of our hospital partners are University of Illinois Health Center, UI Health, Swedish Hospital, 4 Advocate hospitals.
4.
4, is that not cool? 4. Ascension Hospitals, Rockford. But the beauty of all of our partner hospitals, and that's just to give you a few, the beauty of all our partner hospitals, they don't care where you come from. They don't care where you come from at all. Once you have that service voucher from the Silver Lining Foundation, you're qualified. We had a story, one story that I would like to share because I thought it was quite interesting. A woman called us from Florida. See, again,
Florida.
this is the beauty of the electronic world. She was reading about Silver Lining. She had insurance. She was diagnosed with breast cancer. She needed this one test to ascertain basically the spread. Her insurance company wouldn't pay for it. She heard about us, and she called in. She said, I can get on an airplane for like $40 each way to Chicago to get a test. I can't afford $5,000 or $6,000 for this test. Can you help me? And the answer was yes. And she flew in the morning, and she got her test, and she flew home that same night. Number one, I'm obviously very proud of our ability and of our partner hospitals understanding and agreeing to do such a thing, which is the norm for them where we're concerned. But I also think to myself, why did this poor woman have to go through this? And that's why we do what we do, Caroline, is that, we take care of all of this stuff. No one should have to go through something like that.
And I'm hoping that she was okay.
We don't ask.
Okay.
We don't ask because our role, and that's very important, and some people have asked us that. So now you'll know all about me. No, we won't know all about you. There is such a thing as HIPAA. There is such a thing as personal information. It's just not right to get involved in somebody's life other than the fact to make it easier through our funding of a test that potentially can save their life.
I think that is so critical. Can you give the information out again, just because I know we're slowly running out of time, or quickly running out of time?
Yes, we're running out of time, that we know. All right, our website, asilverliningfoundation.org. Spell it all out, don't forget the A. Our phone number, 312-345-1322. And even if you call after hours, voicemail go on, you will be called back. You will. Again, we have the world's best team. They are remarkable, and they care. and they go to bat for every single person that comes to us.
That's marvelous. So again, for people who need the assistance, you know how to contact a Silver Lining Foundation. For people who are trying to think, what can I do?
Right.
What can I do to help? For $135, you can save a life.
And you can ease a life as well. And if $135, we've had people, groups of 10, of young people, and 10 people, some of the schools, the kids donate $13.50. 10 of them, there's your mammogram. There's your mammogram. And if you want to know more about a Silver Lining Foundation, again, we have, our website is extremely thorough. So you can see exactly what we do, all our partner hospitals, you know, our philosophy, our mission, our tremendous board of directors.
I should mention I'm on the board.
Yes,
of
our
directors.
tremendous board of directors here. And that matters too. You know, we must have people that understand our mission and care about our mission. You know, that's what it's all about.
I think just connecting to someone who understands rather than
Right.
not understanding. I think that is a lot of it too, that connecting for someone. And again, this can be a project for a Brownie group.
Yeah, for any group, for any group. You know, it was interesting. I give speeches, which I love to do because I'm so shy. And one of the questions that I always ask is, in this room, regardless, do you know, not even you yourself, but do you, anybody in this room know somebody who was diagnosed with breast cancer? And inevitably, 90% of the people raise their hands.
I think so. I think that now with detection and awareness that
Right.
people do know of others, and it's no longer something to, you know, sometimes people are afraid to say what's wrong with them, afraid to let an employer know or something like that. And so there has been change. Has there been enough?
I don't think there's ever enough change, but I think we're in the process of change. I mean, from when I was diagnosed, and at NBC, what I did when I was diagnosed was that I did a special on my own breast cancer. And the response was absolutely enormous where that was concerned, because in those days, people didn't talk. Now we talk, and that's what's good.
So unfortunately, we have to wrap up. I want to thank you, Dr. Sandy Goldberg, for coming on the show and for your fabulous work, and also to the other co-founder of a Silver Lining Foundation.
Yeah.
Thank everyone who makes life a little bit easier for people out there to need help. Yes, we have a very strong advocate for change. Congratulations, and thank you so much.